It's Selepri, and I want to tell you about my trip to Michigan. I went up to take a student to detox, but this was not just any detox. This was the Advanced Rapid Detox in Farmington Hills, Michigan, that is run by one of Michigan's top anesthesiologists and a renowned addiction physician, Dr. Julia Aharonov. And I am telling you, she is one of the most amazing people that I have met in quite a while. Actually, the whole staff at that place is amazing. And we will get to that later. But I want to give Dr. Aharonov an opportunity to share because I thought my conversation with her was absolutely amazing. And there are things that people need to know about what's going on in the world of addiction, especially when it comes to some of these synthesized opiates. So what this incredible process is and what it means to people who are struggling with withdrawal and detox from synthetic opioids, that question is answered by answering this first question. Why do you do this work?
I do this work because it gives meaning to my life. Being an anesthesiologist was just not quite enough for me. I felt like I was servicing surgeons and not patients. But I also felt like I wasn't making an impact. And when I started doing addiction work, it felt like I was actually making an impact in the world.
And she was. Dr. Aharonov began perfecting a procedure so that people struggling with opioid addiction, especially synthetic opioid addiction, didn't have to endure weeks of grueling and punishing withdrawal symptoms.
And to see a person going from just horrific place in their lives to where they're healthy and happy and productive and good parents, functional members of society, makes my life more fulfilling.
The next step to understanding the value of ARD, or Advanced Rapid Detox, is to understand the other options that are actually being presented to people who are struggling with addiction.
There are three accepted, what's called medically assisted treatment in addiction. One of them is Methadone, one of them is Suboxone, and one of them is Vivitrol. It has been relatively easy to get people on methadone from whatever drug. But methadone is a pure opiate, extremely addictive, extremely hard to get off of, and it doesn't prevent people from using street drugs on top of it. In fact, I have 5 out of 6 patients who are recovering today who are in methadone clinic plus using fentanyl on top of it. And that's pretty much the story for about 80% of my methadone users. So it's not really a good treatment in my mind. But it is a good treatment for people who can't, for physicians who can't get you on anything else, because right now fentanyl, Kratom, and methadone are so prevalent right now, and they're so long acting, and the withdrawals from them are so horrific and long that to get somebody on Suboxone is very difficult as well. It's not impossible, but it's hard. But Suboxone is also an addictive drug. It is safer because it doesn't cause respiratory depression. You can't really overdose on Suboxone unless you really, really try. And even then, there is a ceiling effect where the person will not stop breathing. However, you're still becoming a slave, chained to this particular drug because you can't get off of it. And this is a lifelong thing. And I've had patients who try to titrate themselves down over years and get down to 1 milligram or less a day of Suboxone and cannot get off. Now, Vivitrol is a great choice for preventing craving, treating opioid addiction, treating alcohol addiction. However, for opiates, especially the opiates that are on the street now, to get on Vivitrol is almost impossible.
So why is Advanced Rapid Detox such an essential process when it comes to dealing with today's synthetic opioids?
So 5 years ago, when it was heroin, you could tell people go 3-4 days without your heroin and then take the Vivitrol shot. Go 7 days without and take a Vivitrol shot. This is no longer true. Methadone takes weeks to get out of your system, so you can't get a Vivitrol shot until you're clean, or it will throw you into precipitated withdrawals. Fentanyl, the way it is used on the street, becomes a long-acting drug in your system because it's very lipophilic, meaning it loves fat cells, and everyone has fat cells in the bone marrow if they're very thin, visceral fat, regular fat, and it is stored. And the amounts people use on the street are 1,000 times more than we would use for major surgeries. So in anesthesia, fentanyl is a very short-acting medication. But in the street, and we learned about that only about a year ago, when there actually is a case report where a person was admitted with an overdose and developed other issues, ended up in ICU, and they kept testing him for fentanyl, and he would come up positive 3 weeks, 4 weeks out of the date of admission. At first they thought somebody is bringing stuff to him. But no, nobody was bringing stuff to him. Fentanyl is leaching out of the fat cells. So to get on Vivitrol from fentanyl is impossible without this type of process. And what is this process? Essentially, I'm using the skills of anesthesiologist and addiction physician. So I'm getting them through the precipitated withdrawals under sedation, so they don't feel the horrors of withdrawal. And the withdrawals may last hours. We keep them sedated up to 14, 16 hours, sometimes depending on the drug they're on and how much they're on and their vital signs and what their body is doing. But on the other side, they come out post-acute withdrawal. So all they have to deal with is what's called acute post-acute withdrawal syndrome, which is your body healing itself. It takes a while to heal, and some parts heal faster than others. Opiates, methadone, fentanyl, kratom, all opiates taken long enough dysregulate your hormonal system and your thermoregulatory system. So people may feel the residual effects of that for weeks, as long as several months. It's like having a mini menopause. It does go away, but it's not comfortable.
Dr. Aharonov's procedure turns the malevolent monster of synthetic opioid withdrawal into something that resembles a manageable mini menopausal experience. And that becomes the game changer for people struggling with synthetic opioid addiction and just addiction in general.
Opiates change your body on a not only physiological level, like molecular level, but also an anatomical level. So that needs to be reversed, and it takes time. But this process gets them to where they can't go back to using as long as they stay on Vivitrol. But I don't give them an option of going back to using, because if they're on Vivitrol, if they try using, they will go back into precipitated withdrawals, because on the molecular level, there's still competition going on between the blocker and an agonist. So in the short term. But in the long term, it prevents them from craving. And if they do use by mistake something, it'll prevent them from having any sort of high from it. Vivitrol is an excellent drug for substance abuse, not just for opiates and alcohol. It is used, naltrexone can be used for methamphetamine addiction. It does work because it blocks the dopamine release or the dopamine effect on the opiate cells. So there's a lot of use for it, but you can't get to it. You can't get to it without some kind of help.
Just so we're clear, again now, what's the difference between methadone?
It has been relatively easy to get people on methadone from whatever drug. But methadone is a pure opiate, extremely addictive, extremely hard to get off of, and it doesn't prevent people from using street drugs on top of it.
And Vivitrol.
It'll protect you from craving, but it's up to the patient to stay on it. And one of the drawbacks of Vivitrol is that it is so easy to stop. There is no withdrawal. You can just stop.
The climb from any addiction, especially opioid and synthetic opioid addiction, is incredibly daunting and even impossible for many people. Just when you think you've got a grip to pull yourself up, you slip.
Because most of my patients have gone through 10, 20 rehabs that they have not completed because it's too painful.
Dr. Julia's Advanced Rapid Detox is a necessary tool to help with the climb from addiction to recovery, especially from the iron grip of synthetic opioid addiction.
So my goal is just to make it more humane and to get to Vivitrol as fast as possible and to keep them blocked.
Because here's the truth. If it's not a tool to help you truly break out of addiction, then it's probably a trap to keep you boxed into it. Almost 13 minutes, and you're still with me. Thank you. I am going to break this thing up into two parts. Dr. Julia has a lot to say, and I feel like it's only fair that I let you also hear from Laura Solomon, who is an incredible program director there at the Advanced Detox facility. So I got some things to do. I'm sure you got some things to do. I'll see you soon. Let me know what you thought of this first part. Throw some questions out. Be more than happy to see if Dr. Julia can get those answered. We are in a battle. We are in a battle for people's lives. We are in a battle against an opioid and addiction problem in the United States. And we have to keep fighting. And tools like this, when I find them, I'm going to let you know. And I'm going to do my best to make sure that they are available to people. Have a blessed day. And like I said, there's more to come. Peace out.